What I'm about to tell you may completely change the way you think about your blood pressure medicine from this day forward. Because if you're taking amlodipine, losartan, or lisinopril, there is a very real chance that something you've been calling just getting older is not aging at all. It may not be stress. It may not be poor sleep. It may not be your nerves. It may be your medicine speaking to you in a language no one ever taught you how to understand. And that is where people get into trouble. Not because the medicine is automatically dangerous, not because doctors are careless, but because far too many people are handed a prescription, told their blood pressure looks better, and sent home without the full picture of what that medication can actually feel like in a real human body over weeks, months, and years. Before we begin, please subscribe to my channel so you never miss clear, honest, life-protecting health guidance made for you. I'm Dr. Caleb Mercer, and if you take amlodipine, losartan, or lisinopril for blood pressure, there are 11 things you need to understand right now. Not so you become frightened of your medication, but so you stop being blindsided by it. Because by the end of this video, you're going to understand which symptoms are common, which ones are misleading, which ones are warning signs, and why the most dangerous mistake many seniors make has nothing to do with forgetting a pill, and everything to do with misunderstanding what their body has been trying to tell them all along. Let me begin with Eleanor. Eleanor was 74, organized, disciplined, and proud of how carefully she managed her health. She took her pills on time, kept her appointments, and checked her blood pressure like clockwork. On paper, everything looked excellent. But she kept waking up tired, feeling foggy in the morning, and getting unsteady when she stood up too fast. She blamed age. Her son blamed poor sleep. Eleanor told herself it was nothing serious. What no one had explained to her was that a medicine can be working and still be causing effects that deserve attention. That is exactly why this conversation matters. So let's start with number 11. The first thing most seniors still don't know is that amlodipine, losartan, and lisinopril may all treat high blood pressure, but they do not behave the same way inside the body. That sounds simple, but it changes everything. Amlodipine is a calcium channel blocker. Losartan is an ARB. Lisinopril is an ACE inhibitor. They all lower pressure, yes, but they do it through different mechanisms, which means the side effects, warning signs, and long-term considerations are not interchangeable. And that matters because people constantly assume all blood pressure pills are basically the same. They are not. If your ankles swell on amlodipine, that does not mean losartan will do the same thing. If lisinopril gives you a dry cough, that does not mean every blood pressure drug will. And if you feel perfectly fine on losartan, that does not mean there is nothing important to monitor. The medicine class tells you the pattern. And once you understand the pattern, your own symptoms become less confusing and much less frightening. Number 10 is dizziness when standing up. And this one gets brushed off far too often. When people start one of these medications, or when the dose is increased, the body sometimes needs time to adjust to a lower blood pressure. During that adjustment period, standing up quickly can make you feel lightheaded, weak, or briefly unsteady. A lot of people laugh it off. I got up too fast. Maybe. But in an older adult, a few seconds of dizziness can become a fall, a fracture, a head injury, or a loss of confidence that changes daily life. I remember a man named Walter, 81, who got up from bed in the middle of the night after a dose change. Before he even took 2 full steps, he felt the room tilt. He caught the dresser just in time. He was lucky. Had he fallen, that one moment could have changed the entire course of his independence. Mild adjustment symptoms can happen, but repeated dizziness, near fainting, or any fall-related episode should never be treated like a minor inconvenience. Number 9 is one of the most famous side effects in blood pressure medicine, and still one of the most misunderstood. Lisinopril can cause a dry, nagging cough. And here is the part most people are never told. It does not always start right away. Sometimes it appears days later, sometimes weeks later, sometimes months later. That delay is exactly why so many people never connect the cough to the medication. They blame allergies, weather changes, reflux, dust, or a cold that never fully went away. The cough is usually dry, stubborn, irritating, and exhausting, especially at night. A patient of mine named Harold spent months trying teas, throat drops, humidifiers, and over-the-counter remedies before realizing the cough may have started after his medication did. He was not careless. He was uninformed. But I need to be very clear about something. A dry cough is usually frustrating, not dangerous. What is dangerous is swelling of the lips, tongue, face or throat, especially if swallowing or breathing becomes difficult. That is not something you monitor for a few days. That is urgent medical attention. This is where confusion becomes risky. People panic over the nuisance and minimize the emergency. It must be the other way around. Number 8 is a silent issue that hides in kitchens, grocery stores, and healthy food choices. If you take Losartan or Lisinopril, potassium matters more than most people realize. Many seniors hear that and think, I'm not taking a potassium supplement, so I'm fine. Not necessarily. Potassium can show up in salt substitutes, electrolyte drinks, powdered hydration mixes, meal replacements, and certain low-sodium products that seem heart-friendly on the surface. But Losartan and Lisinopril can both increase potassium levels in the body. And when potassium rises too high, it can affect the heart's electrical rhythm. Sometimes that shows up as weakness, muscle cramping, tingling, fatigue, or a strange fluttering heartbeat. Sometimes there are no obvious symptoms at all until the number becomes a serious problem. I once cared for a man named Victor who was trying to do everything right. He cut down on salt, switched to a better seasoning, stayed faithful to his medicine, and felt proud of his discipline. What he did not realize was that his salt substitute was loaded with potassium. He was helping himself straight into a problem no one had warned him about. Good intentions do not always protect people. Good information does. Number 7 is about kidney blood tests, and this is where fear causes many people to make the wrong move at the worst possible time. Losartan and Lisinopril are not just blood pressure medicines. In many people, they also help protect the kidneys and heart over time. But after starting them, or after increasing the dose, it is not unusual for a doctor to monitor kidney function and potassium with lab work. Sometimes those numbers shift a little, and the moment patients see that, they panic. They think, this medicine is hurting my kidneys. Sometimes a lab change truly is concerning, but sometimes a small early change is expected and manageable, depending on the person, the degree of change, and the overall clinical picture. That is why lab monitoring matters so much. Not because the medicine is automatically bad, but because interpretation matters. A woman named Lorraine once saw a slight change in her kidney numbers online before we had a chance to speak. By the time I called her, she had already decided she might stop her medicine. What she needed was not panic. What she needed was context. A number means nothing by itself. It only means something when you understand what changed, by how much, and why. Number 6 is one of the most important things seniors still don't know. Illness changes how these medicines affect the body. If you're taking Losartan or Lisinopril and then develop vomiting, diarrhea, poor appetite, fever, dehydration, or heavy fluid loss in hot weather, the same dose that felt fine last week may hit your system very differently today. Blood pressure can drop too low. Kidney function can worsen. Weakness and dizziness can suddenly appear. What was once stable can become risky much faster than people expect. And yet so many seniors keep taking the medicine exactly the same way because they think being a good patient means never missing a dose under any circumstances. That is not always safe. I remember Frank, age 77, who came down with a bad stomach illness. He could barely keep fluids down, but he continued taking his medication exactly on schedule because he thought discipline meant never deviating. By evening, he was exhausted, shaky, and nearly collapsed when he tried to stand. He was not reckless. He was simply following a rule without knowing there are moments when the rules change. That is why every senior on these medications should understand that a sick day plan matters. Number 5 is sitting in medicine cabinets all over the country, and people rarely realize how much danger it can create. I'm talking about common anti-inflammatory pain relievers like ibuprofen and naproxen. People use them for back pain, knee pain, arthritis, headaches, and daily aches without a second thought. But when these drugs are combined with medicines like Lisinopril or Losartan, especially in people who are older, dehydrated, or also taking a diuretic, the kidneys can come under real strain. This catches people off guard because each medication seems harmless on its own. A blood pressure pill, a pain reliever, maybe a water pill. Nothing sounds dramatic, but together, they can become a problem. A patient named Sylvia used to take ibuprofen several times a week for hand arthritis while also taking her blood pressure medications faithfully. She never thought to mention it because it was over the counter. To her, it barely counted as medication, but it counted to her kidneys. That is one of the great hidden dangers in older adults. The drug interaction you don't think is important is often the one nobody investigates until the lab results worsen. Number 4 is the side effect that leads many people on amlodipine to quietly suffer without saying a word: ankle and lower leg swelling. This is one of the most misunderstood side effects in blood pressure treatment. People think it means heart failure, too much salt, weight gain, or weak kidneys. Sometimes those issues are worth discussing, yes. But with amlodipine, swelling can happen because of how the medication changes blood vessel tone, especially in the legs. That means fluid can collect around the ankles, often getting worse later in the day. People notice their socks leaving marks, their shoes feeling tighter, their legs feeling heavy by evening. And what do many seniors do? They stay silent. Or worse, they start skipping doses on days they want to go out, hoping the swelling will be better. That is exactly how a manageable side effect turns into poorly controlled blood pressure. I remember Thomas, 76, who was embarrassed by the swelling in his ankles and said nothing for weeks. He assumed he just had to live with it. But medicine should not become a private burden people are forced to endure in silence. Number 3 is about the single home blood pressure reading that ruins people's peace of mind. So many seniors check their blood pressure one time, see a high number, and immediately decide the medicine has failed. Or they see one low number and become convinced it is too strong. That is not how blood pressure works. Blood pressure changes throughout the day. It moves with stress, posture, pain, sleep, caffeine, anxiety, dehydration, and even the fear of checking it in the first place. One reading is a snapshot, not a verdict. What matters is the pattern. A woman named Denise checked her pressure every time she felt worried. If she saw one high number, she checked again, then again, each time more nervous than before. By the end of the week, she had pages of numbers and no real understanding of what any of them meant. The medicine was not the problem, the chaos was. When blood pressure is measured without consistency, people stop seeing truth and start seeing noise. And once someone believes the medicine is failing, they become tempted to skip doses, double doses, or demand changes based on fear instead of pattern. Number 2 is about missed doses, and this one causes more trouble than people realize. Amlodipine, Losartan, and Lisinopril are not rescue drugs for emotional moments. They are long-game medications. They work best when taken consistently, at the same general time, in a stable routine. But when people miss a dose, panic takes over. They try to catch up. They double up. They take an extra tablet after a stressful reading. They make a decision in fear. And fear is a terrible pharmacist. I remember George, 73, who forgot his morning pill, took it later, then took another one that evening because he got nervous about a higher reading. The next day he felt washed out, dizzy, and weak. He thought his condition was worsening. In reality, he had created a problem by reacting emotionally instead of following a clear plan. If you do not know exactly what to do when you miss a dose, that is a conversation to have early, not in the middle of a panic. And now number 1. The most important truth most seniors still don't know is this: the best blood pressure medication is not the one that gives you the prettiest number for a short period of time. It is the one you can live with safely, consistently, and intelligently over the long term. That is the truth people miss. A medicine may look perfect on the chart while quietly becoming a poor fit in real life. If it makes you miserable, if you do not understand its warning signs, if you secretly dread taking it, if you've started skipping it without telling anyone, then the treatment plan is not as successful as it appears. Amlodipine may work beautifully for one person and cause frustrating swelling in another. Lisinopril may protect the kidneys and blood pressure well, while causing a cough someone can no longer tolerate. Losartan may be an excellent alternative for many people, but it still requires respect for hydration, kidneys, and potassium. The right medicine is not just about what lowers the number, it is about what fits the person. I think about a patient named Ruth. Ruth was 71, and her blood pressure looked wonderful on paper. Any quick glance at her chart would have suggested success. But she was tired, discouraged, and quietly losing confidence in her treatment. She had symptoms she did not fully understand, worries she was embarrassed to mention, and the growing feeling that the medicine was controlling her life more than helping it. When we finally sat down and talked honestly, the issue was not that she was weak. The issue was that she had been trying to be a good patient by staying quiet. And that is where so many people get hurt. They think silence is discipline. It is not. Silence is risk. Let me leave you with this. Side effects are not character flaws. They are not complaints for the sake of complaining. They are not signs of failure. They are information. Dizziness is information. Swelling is information. A dry cough is information. Weakness during an illness is information. A racing heartbeat, unusual cramps, tingling, worsening fatigue, near fainting, or strange changes after a medication adjustment are all pieces of information. Your job is not to diagnose yourself. Your job is to notice the pattern and speak up before the situation becomes dangerous. Too many seniors believe being a good patient means being easy, quiet, and undemanding. No. A good patient pays attention. A good patient asks questions. A good patient reports changes early. Because the people who get into the most trouble are often not the careless ones. They are the polite ones. The ones who minimize symptoms. The ones who do not want to bother anyone. The ones who keep swallowing the pill while their body keeps whispering that something is not right. And whispers have a way of becoming emergencies when ignored long enough. So here is the simple truth I want you to remember every time you take one of these medications. If you take amlodipine, pay attention to swelling, flushing, headaches, dizziness, or heavy feeling legs. If you take lisinopril, watch for a persistent dry cough, dizziness, and especially any swelling of the lips, tongue, face, or throat. If you take losartan, watch for dizziness, weakness, dehydration during illness, and any signs that potassium may be drifting too high, like muscle weakness, cramping, tingling, or an irregular heartbeat. With losartan and lisinopril, lab work matters. With all three, consistency matters. And with every one of them, unexplained symptoms deserve respect. Not panic, not denial, respect. Because once you understand how your medicine behaves, the fog starts to lift. You stop assuming every symptom is harmless, and you stop treating every small effect like a catastrophe. You become calmer, smarter, and much harder to harm. That is where safety lives. Not in fear, not in blind trust, in understanding. If this helped you, share it with someone who takes blood pressure medication, because there is a very good chance they need to hear this too. And as always, I'm Dr. Caleb Mercer, and I'll be right here in the next video helping you understand the health truths that matter before they become the health scares no one saw coming.